I'm going to go over a patient that to me makes a great point about a confusing issue out in the hair transplant, hair restoration world. His story is that without any question whatsoever, without any discussion whatsoever, he is not willing to use the Finasteride. Not going to do it. Now, for those of you out there who might have spoke to me before or had some sort of correspondence, I don't try to preach to people. I don't try to lecture to patients. All I do is give objective information about the realities of what the good and the bad can be from the use of Finasteride. In this case, at a young age, going back to his photos, if you look at photo number 1, he can get a tremendous boost. He's Middle Eastern, he has strong hair, and I see that crown is completely growing in. But at this point, it's a moot point because he's not going to use the medication. So he also discloses to me that he's reached out to a few other doctors and that doctors have told him that he's probably a better strip patient because the FUT procedure, because he's not willing to use the medicine, he's young, he has to preserve his donor, all the pros that line up from using the FUT, which is absolutely correct, and what his expectation should be, and also he needs to obviously realize that at a young age, he's probably going to lose the entire top of his hair on top of his head. And then we go to photo number 2, which seems to be, to me, a little disturbing. And by that, I mean that what I'm seeing from this photo is that it looks like he's got some miniaturization in the donor zone, and that's a red flag. So that's concerning. We go to photo number 3, and we can see the entire top of his scalp, which actually is a very good shot for anyone wanting to send in photos, because then I can kind of see the future of what we can do both with hair restoration if it becomes an option and the use of the Finasteride. We're going back to photo number 2. This concern is that since he's got diffuse thinning in the donor and he does FUT, he's very young. Most guys, not all, want to wear their hair short in the back of their head. The problem is if he continues to diffusely thin, even in the donor zone, are you going to see that scar through his hair? That's a question I can't answer. That's a question that you can't answer, he can't answer, and that's a question that his hair transplant doctor cannot answer. So it was very concerning to me. Now I flip over like I'm talking out of both sides of my mouth and I say, well, you're probably a better FUE candidate at this point, even though he's got a lot of hair loss, which is borderline unethical. But I'm just trying to give him everything to make a decision on. So some patients that reach out, they just want a little bit more hair. They don't mind that they're still bald or balding or thinning, but they don't want that scar in the back of their head. When I get toward the end of the conversation with the patient, he discloses to me that he probably would be okay shaving his head. So guess what the answer is? And guess what we decided on? Yeah, that would be the best decision. If you're not willing to use the medication in order to preserve and enhance your hair so that you can not worry about these pros and cons of either procedure, if you're not going to use that medication and you're okay with shaving your head, this makes a pretty quick conversation. That would be the best option. So the reason I wanted to bring this to your attention today is because people out there or clinics out there that want to sell hair transplants, that want to do an FUT procedure, I mean, they don't see anything that they're doing wrong. As a matter of fact, they're not doing anything wrong. This patient's going to have to wear his hair longer to cover the scar, but they don't think forward far enough to realize that there are cases where that diffuse thinning, no matter how long you wear that hair, will show that scar, and that could be a potential problem. The other side of it is if you choose FUE, you get very little hair, you spend a lot of money, and you continue to lose your hair. Was it even worth it? So, as a lot of you know that watch my videos, I'm always looking out for the patient. I'm also trying to make this just a better overall industry. There's no one particular doctor that does everything right. There's a lot of elite doctors that do their best every day to protect their patient and turn away surgery when it needs to be turned away. In this case, the right thing to do is to turn away the procedure, inform that patient he's better off not doing a hair transplant. Don't forget to like and subscribe to the McGrath Medical YouTube channel.